Okay, this is fun. Everybody wants to keep eating, can keep eating. So I'm very glad to see everybody. And the main thing is, I think, is that you're coming out. It's been so long. Everybody likes to stay at home. So we like to put these programs together because we want you to come out together, meet each other, talk, find out what's going on with each other, and we have an incredible program today. So why is music medicine? Today, as we explore drumming together, we'll see this science in action, and we'll experience the joy and connection that rhythm can bring. But I'm going to leave the science to the doctors. But the truth is, we all have rhythm. Our heart beats, we breathe in and out, hopefully, because a lot of people forget to breathe out. So breathe in, or we forget, we gotta breathe out. The way we eat, the way we brush our teeth, the way we walk around, this is all our rhythm. This is our music of life. So the rhythm lives in our body, whether we know it or not. And we have rhythm, whether we think so or not. So today we're going to explore how rhythm and music can help us move, connect, and live better with Parkinson's. But I want to thank our sponsors, and especially Dr. Rebecca Gilbert. The APDA has been so generous, and they gave us a community grant. We're a community grant recipient, and we're very grateful to you for that. And I want to thank Jessica and Tara from AbbVie for always being behind us, and Christy, our new friend. Thank you from AbbVie. And I didn't see Jordan today, but she's from Surprise. Is Jordan here? Okay. So thank you. And you'll get to meet Esty, who's running the art bowling table. So please meet everybody there. Okay, the origin of this whole drum story happened because good friends of ours, Alan and Naomi Holstein. Alan was coming to our classes, and Alan has a couple of friends here today. And I'm sorry that Alan and Naomi are not here. They had a family issue that they had to deal with, but they wanted to be here. I discovered that Alan was a drummer, and he was coming to our classes. And I wanted to find a drummer to teach drumming classes. So he said, he went from being this tall to this tall. He said, I'll teach those classes. So we developed a program together. We put together 4 classes. We had a group of people to come, because some of them are here today, and it was great. But I saw that Alan, it was a little too much pressure just for Alan to run the classes, and we knew we needed a professional. And that's when we met John McDowell, who is one of our drummers today, who we'll be working with, John. And John will be co-leading our drum circle along with Mordecai Friedrich, who's sitting next to him. So let me just tell you a little bit about John. He's a professional, he's a percussionist and an educator, and a highly skilled composer and performer. I've heard him play the piano. It's the most gorgeous music you play, and your composing is beautiful, John. He's trained Western classical music and in Africa, in West Africa, and has also composed original musical scores. He believes deeply in the power of rhythm to build connection, confidence, and joy. And Mordecai Friedman, who I met recently, and I'm very happy we did, is founder and facilitator of Go Do Pata team circles. He combines his passion for music and belief in the power of teamwork. And that's why we're all together. And that's why we're going to be doing this drum circle together. Over a decade of experience in the corporate wellness industry, he successfully facilitates rhythm-based drumming events that inspire unity and collaboration. And together, they will create an environment where everyone can participate, everyone today here, regardless of your experience. I want to introduce our great doctors today. So we are blessed to have these doctors here. You all know, and everybody knows Dr. Rebecca Gilbert and Dr. Alessandra DeRocco. And I'm grateful they come from New Jersey and the city to be here with us. So Dr. Rebecca Gilbert, she joined the APTA in 2018 as Chief Scientific Officer and transitioned to the Chief Mission Officer, which I always wanted to ask you what that mission officer meant in 2024. But she's responsible for overseeing all the APTA's research portfolio. She does all of these incredible interviews on YouTube. You could listen to her, and she interviews great people from all over the world, actually. Dr. Gilbert and Dr. DeRocco met, I think we were talking, Dr. DeRocco hired Dr. Gilbert at NYU Langone, how many years ago? 2009. So they are an amazing team, and I'm happy to have them here together. Dr. DeRocco is a highly respected movement disorder neurologist. As most of you who are here, some of you are here, half of you as your very own doctor from Northwell Health's movement disorder program, and he's professor of neurology at the Zucker School of Medicine. He served as the founding director of NYU Langone Medical Center Fresco Institute of Parkinson's, and he's on the board of directors of Parkinson's Foundation. And it is Dr. DeRocco. He has a love of music and a love of movement. I met you. I didn't meet you, but I saw you speak at the JCC in Manhattan with David Leventhal probably 15 years ago. And I said, that is a neurologist who appreciates music, dance, movement, and knows how important it is. So he's the reason why we have this event called Music is Medicine. All thank our volunteers, of course, so please give me the time to do this. Sam, Susan, Naomi, Bernadette, and Solange for creating a beautiful atmosphere. Thank you very much. The other thing I just want to say, Naomi Colston's not here, but she gave me the idea to invite family and friends to this, because she was saying, I want my family and friends to know what I'm going through. I want them to understand what Alan and I are going through. So it's important that PD should not be a secret. We need to talk, share, and that's why we've invited our friends and families here tonight. So we don't feel alone. So I'm sorry they're not here to meet them, but this is inspired by them. Just want you to know that the door prizes are those 3 djembe drums over there, and we will have 3 lucky winners, but you have to stay to play. Okay. And after the drumming, we'll have a dessert table, so just want everybody to know that. And before I give the stage over to our great doctors, I want to thank my mother. My mom's here. She's my teacher, my inspiration, and she taught me that you are only as good as the people you surround yourself with. And Mom, thank you for being here with us. So, 4 years.
Well, I'll start by stating the obvious that it is not only a great pleasure and honor to be here, but it's such a joy being with Susan. Susan Lost is it's really someone who with grace, and I think we all seen it, creates events like this, brings together a community. Has created a program which is unique, which is far-reaching, and and want to say thank you, Susan, for and I want to thank this community. I was actually reminiscing that the first time I was a fellow to finish my residency. I was in Mount Sinai, and my boss sent me to Nyack Hospital. There was a support group to talk, and I was completely intimidated. It was the first time in which I had this kind of interaction. And I think it was, sort of a revealing moment. And Nyack was for me, it was the first time I came to Nyack. I just came from Italy. And I was embraced by the community. I think I remember so distinctly that day because it was some 30 years, more than 30 years ago. And I'm happy to be back in this community. And I think it gives us sort of a great, it's a great and important moment to come together in a different way. So in the clinics, especially in this day and age, we are bound by times, by really very limited sort of opportunities to really have a dialogue. And of course, a lot of focus on medication or on some very specific programs or the general management. And then there is, this long time in between visits where I think we have defined the desert of care. What happens in between the months, between one visit and another? Yeah, maybe an occasional phone call. And in this sort of moment is really what defines in many ways life. So of course the medication are important, and of course the treatment or whatever is done in the clinic is important. But many times, we end up rushing recommendation. Make sure you exercise. Make sure you not really having the time and opportunity to go over how important that is. How important it is from the scientific point of view. How much we learned that, certain modalities of exercise and certain ways in which we train our brain. Drumming may very well be one of this. Music certainly is one of this. Help sort of mitigate and help the brain sort of find some new energy, some ways that are really medicine on their own. And as a medicine, we really don't have time or the opportunity to really ever discuss. And a lot of this medicine doesn't come from, a pharmaceutical industry or a laboratory. It comes from communities, comes from observation, from people who observe and learn and come together. So this is it's a great moment for us. Even as we were preparing, we were reflecting on this because our training is medications, surgeries, or treatments, and we learn by being part of the community how important certain modalities are. So I want to ask Dr. Gilbert, when was the first time you sort of became aware that music and rhythm were important for people with Parkinson's?
Does this work? So yeah, to answer that question, you're right. When you start your training and you're sort of really grounded in Western medicine, everything has to go back to medications and this and that. But really early on in my fellowship, one of the things that you learn as a treatment for this very difficult walking pattern that people with Parkinson's can sometimes have called freezing of gait. And some of you may be aware of this abnormal walking pattern that can be so difficult. What happens is your feet tend to get stuck on the floor, and you can take multiple steps in place before you move forward. Your body, the top of your body, wants to move forward. It could be a big fall risk. So you learn a lot about freezing of gait, and sometimes it's difficult to treat. But one of the things you learn early on is that cueing or giving your body a signal can help overcome that freezing of gait. And one of the classic ways of cueing is walking to a rhythm. And so some would say to start a metronome and have a rhythm be tapped out and walking to that rhythm and push the freezing of gaits to overcome it, and you start stepping forward. And so really early on in your training, you get this sort of interesting fact that rhythm can be very helpful to a specific motor problem in Parkinson's disease. Without really understanding why. We don't know it really explained why, but we just know that this is like a phenomenon that happens. So rhythm is a therapy. And I think that is really a very bedrock, essential thing that people with Parkinson's may intuitively know and is sort of supported by their doctor. So that's probably the first time that I was aware that rhythm can be therapy. And then it goes from there. Obviously, there's a lot more positives that can be drawn from rhythm and then its extension music. So I'll ask you, beyond rhythm, when was your first sort of interaction with music to help people or to enhance people's lives with Parkinson's?
My first interaction was part of my training. And we had a patient who was a dancer. And I remember distinctly again how she was mentioning and gave a demonstration that how it was sometimes difficult to move from one room to another. But if she would dance her way, and she put some music and dance her way from, I don't know, the kitchen to the bathroom, she could just sort of go. And, you know, there was a part of me that was almost in disbelief. Also, historically, I think it's important to point that out. It's only been the past 15 years that awareness, that exercise and movement, and the certain type of training the brain with rhythm, with music, with different modalities, has become scientifically supported and part of our really belief. So it was sort of something that came from the bottom up. It came from observation that people made. And this is one of the observations that sort of opened my eyes very early on. And then on my own, I would start telling people, why don't you dance your way, without really having a basis for this. Talking to someone who has a background in dance. And I think that awareness sort of has remained with me and transformed my way of thinking. The way in which we think of this disease. And I want to make sort of touch upon the evidence. So, as you actually are really kind of the hub of a lot of what's happening in the world, really in the globe, about research more than anybody else. Really, everything crosses your path. What is the scientific evidence that we have now about, how movement and certain forms of movement, like rhythmic movement, like dance or music-based activity, work?
Let's jump in there and say, so for a long time, there wasn't a lot of people studying this. It was sort of a bottoms-up phenomenon. A dancer would experience this, and then sort of it was anecdotal. And then I would say over the past 15 or so years, there have been formal clinical trials that have looked at various modalities. Certainly dance has been studied, ballroom dancing has been studied, tango has been studied, and in a very rigorous way, where you have people who are in the program and people who are not in the program, and then there's quality of life measures that are looked at to see whether there's been an improvement. And pretty much any activity has shown these benefits if it's studied rigorously, including drumming. And when I was asked by Susan to come here, I didn't know there were any actual scientific papers on drumming, but in fact there are. There was a paper, I think, in 2024, which looked at a group of people who were in a drumming program and people who were not, and followed them. And in fact, there was improvement in quality of life in people in the drumming programs. So it's very encouraging to see that the sort of the unbiased evaluation of some of these activities does bear out that there's benefit. And I think one of the crucial pieces of this is that these activities are within a person's control, meaning there's so much about Parkinson's that you can't control. And so kind of focusing on the parts of your life that you can be very empowering. And finding an activity that you find helpful and useful and that you can do, I think is really a way to bring hope and joy to people who may feel that there isn't as much of that as they would like. So I think that's an aspect that's really wonderful about drumming and about some of these activities we're talking about. I'm going to ask you a question about when you have a person who comes to you, and isn't necessarily somebody who's familiar with any of these activities, and sort of maybe a little overwhelmed by their diagnosis. What is your approach to introducing some of these creative activities or these music-based activities or rhythm-based activities to someone who hasn't considered any of that?
And the reality is most people, reach the time of diagnosis, usually around age 60, it can be before, it can be after. And many times when, people have been busy with their lives, whether, whatever it is, work, family, and the last thing, since they left college or high school has been dancing or music or exercising. And suddenly you have someone, not only gives you a diagnosis of Parkinson's disease, and of course, there are many steps, and this is probably now the time when we talk about the challenges. That moment you're confronted with that. But there is an early stage, and part of the message that has changed is not just about take this medication and good luck. The message, especially at the beginning, is try to find a way to incorporate activity and certain activities more than others in your life. It's become such an important part of our awareness that especially in the early stages, this really becomes a central part of the discussion. To the point, some people come prepared and say, "I haven't done any exercise yet, but I'm thinking about that." But there is a challenge in finding the way. There are many challenges to this. Someone will tell me now, you have Parkinson and you have to change your life, start exercising, go into a dance class. And how am I going to do that? I still want to keep my job. I still love to do, I have millions of other. Where's the time? And where is an environment where I can do it? How can I do it in a place where I feel comfortable, where there is even an understanding of what the specific of the exercise have to be. And I think that sort of becomes a dialogue. And I think we're lucky in the New York area because we have you know, we have people like Susan who has created the structures where you can be safe, you can do the right things, and there are other programs. But they're not enough. And I think that in many ways, in the, you know, in the larger community outside these walls, one of the challenges is not necessarily embracing the concept, but how am I going to do it, both at a personal level and in terms of how can I just go to a gym and, you know, start doing, you know, join a class in which I don't belong, in which I will feel uncomfortable. I think those are real challenges, and that's why it's important in some ways to affirm and define that this is not, you know, not a pastime, not you know, something that you do on the side, but probably the single most important things one can do to redefine Parkinson as an annoyance. As we always say, the goal is to make Parkinson not the center, you know, of one's life. But obviously, it's impossible not to be aware that, you know, your movement have changed and your way of doing things has changed. But how to sort of make sure that, you know, you embrace all the activities that will make this journey easier, and not just also from the physical point of view. And I'm going to sort of now ask you about, you know, how much you think that, you know, music and exercise, and, you know, some of the other modalities that are part of the non-pharmacological treatment transform the life of patients, people with Parkinson, not patients, is beyond the physical. Do you think that? Do you think it's real? What we all believe that there is benefit in many other aspects: cognitive, emotional, mood, and in general, in redefining quality of life.
So I think there's a lot of different elements that, you know, kind of to segment, you know, this broader conversation. The first is exercise, and you know, that is clear for, you know, all people, you know, whatever age you are and whatever diseases you have, as you know, and especially as important as people get older. That exercise is very important. The CDC, for example, has guidelines for all older adults. It does not segment out people with Parkinson's. You know, what a person as they age should do in a week. And it's 150 minutes a week. So that's 30 minutes 5 times a week. And that is that's aerobic activity, raising your heart rate to the point that when you're having a conversation, you have a little bit of difficulty having a conversation with someone else. So that sort of moderate level activity. So there, you know, very strict guidelines about what's healthy for a person, for all people. So that's one aspect of this is exercise, aerobic exercise. There are other elements of exercise, weight training, stretching that is incorporated into these guidelines. So there is science behind that, and that can be really difficult to meet those guidelines. And so you want to, when you're talking to people, and they're asking you, what specifically should I do when you go through these pretty specific guidelines, you want to make sure that people realize that, you know, meeting those guidelines are ideal, but doing more than you're doing now is better than not. And so do what you can, you know, and try to stage it so that you're not overwhelmed and just give up. And another lesson that I try to keep telling myself is that Parkinson's can be really, really challenging. And so what you don't want to do as somebody who's offering treatment to somebody with Parkinson's is make them feel guilty, you know, that they're not doing enough, that somehow this is their fault you haven't exercised enough, therefore your Parkinson's is the way it is. That isn't fair and it isn't true. And people are trying their best, and that is where I would be people. You know, it's not blame the victim kind of situation. You want to make sure that somebody gets the information and then just does their best with it. So that's exercise. And then there's the music-based therapies that we've been talking about, and that can include drumming, dance, actual music, even just singing. Singing is another whole level of music that can be really helpful to people with Parkinson's because it can exercise the voice. Sometimes people with Parkinson's have a very low voice, and singing can be a way to get that volume up and get the emotionality up, and can be very helpful as well. So I think that aspect of creativity is really vital. And then there's something that we haven't talked about yet, which is novelty. The brain loves novelty, so learning something new. And this may be learning how to move your body in a different way. So that could be learning how to do boxing. Maybe that's why boxing can be so impactful to someone with Parkinson's, because you're doing these movements that you didn't know how to do before, and your body's learning this new way to move. And so I think incorporating novelty is really important, and hence drumming. I don't know how many people here have done drumming before. Anyone? We have a few hands. So for most people, it's a new activity, and that's a great thing. And that's something that we should say thank you to our drumming people for introducing something new to everyone. So, do you want to take any questions? Yeah, maybe this is a good time to. Does anybody have any questions? We'd like to open it up to you for a little while. You could ask.
No.
No.
Well, thank you so much. I just have a question. Without maybe getting too technical, I was wondering, what are there examples of how someone could improve from music, drumming, singing, dancing, whatever? What if someone, let's say, person does it for a year? What might they improve on? Like the gait, the physical walking, or was there some things that I don't know could help? Good question, because there are different ways in which different modalities are more helpful. So there was a study years ago. It was actually based at the JCC in Manhattan, and when we had a singing class. A singing class comparing with traditional speech therapy, which was done at the Rehabilitation Institute. And we were measuring the volume of the voice, how well words were articulated. And we're also measuring mood and well-being. And were the same number of sessions. So you had, number of sessions doing speech therapy with a certified speech therapist, or a number of sessions in a community with someone playing the piano and singing Broadway tunes. And the results were incredibly striking. So the people who were doing the singing had a much better outcome and maintained that improvement than the people who are doing traditional speech therapy, which helps, which is one of the scientifically demonstrated modalities which helps. The speech is just one example of that. So there is a way in which, we need to capture that. Dr. Gilbert was mentioning about the rhythm. So there is a phenomenon that many people with Parkinson's have, which is freezing of gait. So you walk and then you go, especially when you go through narrow spaces, really your feet almost get glued, and this can sometimes leads to falls and it's hard to, we really don't have a good estimation. But we know that there are certain modalities that are not drugs that have to do with rhythm or with certain visual interactions with the brain that specifically help that. Now, the other question related to this: how sustained is the benefit, which is the challenge. And I figure that, it's either you do that, you do, a singing class, and your speech is forever, 6 months of singing class, and you don't have to worry about your speech anymore. You have to maintain that. And this has to do with the fact that when you do this, you reorganize the brain in a certain way. There is a concept called plasticity of the brain, so the connectivity. So different modalities have different volumes. So certain modalities about dance, there is sort of so much evidence that it is also building, because, but a lot of people with Parkinson's don't have trouble necessarily walking, but the balance becomes difficult when you turn. So if you learn how to do this in a context with dance, you can actually extrapolate and then apply that. And it has been shown that the number of falls people who do sustain that is less. So different modalities at different volumes. And, and then there is a collective volume, which I think I'm going to add on. I'm sorry if it's a very long answer. There is something we wanted to sort of emphasize, and that became very much aware. I was very much about with the JCC Manhattan, where there's been a Parkinson programs been going on for some time. The energy, the connectivity, the social, the engagement is therapy in itself. And not everybody responds in the same way to different ways. Maybe we just don't want to dance, or just want to sing, or just, there are different ways. But the coming together, the fact that you did this, as a community, has many other implications. From social, a mood, coming together, not feeling you're the only person in the world who has this problem. So there are many different ways which this can happen, and very, very practical, very, very visible, very tangible.
Yeah, I have a couple simple. First, I'm involved in study because I just think it's more of a visual thing that I'm freezing now. Well, first of all, does everybody with this face freezing in Parkinson or trembling Parkinson conditions that we have? Does everybody go through that eventually, or is just certain things type of Parkinson? Okay?
So yeah, not everybody experiences exactly the same thing. There's a number of people who have no idea what freezing of gait is. It's a subset of people with Parkinson's.
And then I want to know, because I'm going to be involved in a study next month, where I'm going to have visual goggles on, and EEG, and they're going to see if they can have me go through a maze and learn.
Fantastic.
Something new. And besides that, dance, musical, I'm trying all those things myself, but except in the tree myself. Anybody else experience something like that? Like they put, like I've never used them for gaming and stuff like that, but apparently that they kind of watch what my brain does and hopefully.
That's fantastic. So what you're referring to is a different kind of cueing. So cueing is sort of like giving the brain like a little bit of a boost. And so one of the ways to cue your brain that something's wrong, get out of this freeze is the rhythm. And another one is a visual cue. And so you might see these devices called like a laser cane, where they generate a line on the floor and you step over it. So what I'm imagining is you're going to be in a clinical trial of some kind of visual stimulation that's going to allow you to overcome the freezing of gait in a situation where you were freeze. So that sounds great. And this is another to point out that you're in a clinical trial, which is fantastic. It's a way to give back to the scientific community, to enhance knowledge, to possibly help yourself, all at the same time. So being involved in clinical trials is really a fantastic thing. So thank you. My name is Hope. Thank you, Susan. This question is for the doctors and also for John. Dr. John.
It's about breath. And Susan started by the importance of an out breath. Because without a full out breath, you don't have the, I guess, the dynamics to take a full in breath, right? It's the out breath that creates the space for the in breath to come. And a previous program that Susan offered had somebody who wrote a book about breath, I believe. I don't remember exactly who he was, but he was wonderful. So I'm a massage therapist by training, so I've learned something about the body and movement. And my question is, like, even with drumming, you know, a lot of times we think drumming, oh, we're using our arms, we're using our hands, striking the drum. But I'd love for any and all of you to talk about the importance of breath with any activity that we are doing. And, you know, I've just been really hearing a lot about the difference between a 3-year-old who will go through a day and an adult. Like, I think we're a very still culture and kind of taught to be, you know, careful, you know, how we move, especially around other people. So, I've ever been in a room with children that are trying to get to a sea of adult legs. You know, they'll just push you aside and walk through. So my question within the story is kind of, how can we kind of reclaim, you know, exercise is sort of a bad word for me, but how can we kind of reclaim our movement, our ability to be in the world fully in our bodies, even, you know, when we're doing something, I think we're just using our arms, but we have to breathe.
I think that's a great note. Unless you want to say something.
Yeah, I was just gonna say one thing that what you were expressing reminded me of that people with Parkinson's, one of the symptoms that a doctor looks at is smallness of movement, and so one of the ways to try to counteract that tendency for smallness, and this includes breath, you know, that not taking those deep breaths, is to counteract that with big movements. Taking big breaths in, big breaths out, moving in a really big, purposeful manner. And that is a type of physical therapy that is practiced on people with Parkinson's, so that the automatic kind of smalling of movement, which would be not what a 3-year-old does, and making it big, like to counteract that tendency. So I think that's exactly right.
No, I think that was a great comment, and I think we're running short of time for before the next sort of section, which is the drumming. And I think we're going to get
Less than how it was, I must say. But they're going to join us drumming, so everybody grab a chair, grab a drum, and I'm going to hand the program over to John and Morgan.
So that's the question. Doctors, that's still all the question.
yes.
It starts with the child. My name is Yoli. I run a program in Borough Park. We have close to 70 participants as of now. It's a big program, and it's all thanks to Susan. The child approach, not only what she did for what we do, it's the history. The Borough Park was all created by her ideas, and she brought the doctors down to us already. We, thanks God, have the privilege to serve close to 70 people joining the program, the daily program with classes. Now, the question is actually not my question, it's the question from all these people that come to us every day, daily. We saw this on the weekends. They're all asking us, is it something that they have to do every day or a couple of days in the week with cover, or do you see a difference in somebody that does twice or 3 times a week goes to a class than somebody that does literally every day for a shorter period, let's say for half an hour? If that would be a bigger outcome. Thank you.
So, one aspect of this is if you say to yourself, I'm going to do this 3 times a week, that's enough. That 3 times a week very quickly goes to 2 and then 1. Doing something every day is a habit, and it's much more easy to sustain something that you do every day than not. So I think that's a psychological truth about habits. So that's something to keep in mind in general. In terms of what gives you the best medical benefits, what I mentioned before, the CDC mentions is 150 minutes a week, and so their suggestion is 30 minutes 5 times a week, which means that you get to have 2 days off. Probably, if you do it 7 times a week, it's better than 5 times a week. I mean, that's just sort of how things work. The more, the better. The more rigorous you are, the more steady you are, the more intense you are, it's going to be better. However, I'm always mindful of the challenges. You know, we don't want people to feel like they're failures if they haven't done the ultimate, because that isn't fair and it isn't true, and nobody's perfect anyway. So we want to make sure that people understand that your best effort is laudable, and we're very proud of you. So we wanted to leave with that.
Great. Okay. Great job. We're going to do some